second focuses on an approach to build public health capacity for leading partnerships. This is a high priority in this funding. You know, if you look at their notice of funding opportunity, they talk about you'll be expected to collaborate and partner with all these different types of organizations. And one ideal way to do that and get a lot of value for your dollar and impact is to collaborate on the positive and adverse childhood experiences and early childhood development coalitions. ACEs are the root cause of root causes for most health challenges, and it's a primary driver of disparities and inequity. But yet most communities, or hundreds and hundreds of communities, have motivated coalitions that have come together, but they're often very under budgeted and lightly staffed. So for public health to step up and work with them, they can build really strong partnerships from the get-go. And one of the reasons this is such an ideal topic to work with is that there's national networks that you can tap into so you don't have to reinvent the wheel. And one of those is PACES Connection. And that's where I'm going to just let Carrie share a little bit about PACES Connection, and then I'll share about the ARC and the ARC Wiki.
Thank you so much, Bill. So PACES Connection, we are the vast container, the Library of Congress, the Wikipedia of all things having to do with positive and adverse childhood experiences. We are a great repository of evidence-based materials, studies. We have an updated, constantly flow of the latest information on it. We have communities that are out there gathering information, and we are disseminating best practices. We are the social network of the PACES movement to bring the science of positive and adverse childhood experiences into every aspect of our lives, because as Bill said, it's the root of problems. And truly, when people understand this, they get that this is based on, this is your community why. PACES science is your community why, because we look at the impact of toxic stress on the brain and the fact that this has lifetime health consequences. What happens in childhood affects our length of life, our quality of life, what we do in our lives. So the impact on the body, the impact on epigenetics, how our diseases are passed on and expressed generation to generation. And then also the positive childhood experiences, which we know there are 7 that are counted. 4 of those positive childhood experiences happen in community. Being able to participate in community traditions, having friends in school, being accepted in high school. Now, I don't know who really felt accepted in high school. We're probably a bunch of nerds here, but nonetheless that, and then also having 2 caring adults who honestly cared about you. We can teach communities how to do this. And what we do is we connect communities and people with the support to do this. Across the country, we've got, and around the world, 430 city, states, and countries that have communities on PACES Connection, and they get a free website, they get a ton of great tools, they get the guidelines on PACES Connection, and they get to connect with each other, and they get to connect with other people in their communities who are doing the same thing that they are doing, so that we start getting these cross-sector communities going, because as Bill said, silos will kill us. We've got to start working together across sectors so that we get sustainability. We've got more than 56,000 members. We add members every day, and they are there sharing their best practices. It's so exciting that the public health departments could be the backbone organization to join in the PACES communities that are already in existence, or they can start a new PACES Connection initiative. We make that very easy. I don't know if Matthew Portell is on this call, but we have a director of communities, and you just fill out a simple form and we get you started with a free website to get your community going. But if the health department teams with the existing community or starts a community, you've got this strong backbone then that gives you entrance into all kinds of the schools, the police departments, the other businesses in the communities of faith, the recreation departments, because it really takes everybody doing this all the time so that people hear it at work, at school, at home, at the doctor's office. And then it starts to get sticky and stay. And what you end up with is sustainability. So we offer tons of free training. We have about 16 hours of free training that we offer in our Creating Resilient Communities courses. You can just log on, sign up, show up, and we even give a certificate when you've gone through all of those. Our Growing Resilient Communities training is for communities that are already in existence, and we help them learn how to educate, aggregate. We've got to track what we do. If we don't track it, it doesn't matter, but if we track it, it helps us get funding, and it helps us get places that we might not have gotten to without being able to say, we've trained 3,000 people on this, and then people go, whoa, we better learn about that too. So that we educate, we aggregate, we engage, we activate people, we give them things that they can do in the communities, activities that they can do, and then we celebrate, and then we connect them with another organization that can help them learn how to advocate for what they need to get that health equity that we're talking about, to get the diversity, to get the inclusion. And then we do sustaining resilient communities for communities that really want to use more sophisticated tools to help track what they're doing and really measure how they're doing as they go into each organization, because it takes going across organizations to get this work done. Something that we've done to great success in North Carolina, which is identify a leader to help grow a 4-county collaborative. So imagine you've got 4 counties that normally kind of work together. It's a Northwest Georgia or Southwest Missouri or whatever. We can help find a leader to help grow a 4-county or 3-county collaborative, and then help that person with you identify the people who need to be at the table, and then help you invest wisely in sustaining a multi-county program that you can track. We're doing that now in North Carolina to help improve the health and well-being, particularly of people in the foster care system, and it is working so well. Our funder is really excited about this, but if the funder is the public health department, this is right up your alley to aggregate and to be stronger together to do this. And then you join, if you want to show the next slide, Bill, our cooperative of communities, which gives you access to a more sophisticated tracking tool, gives you access to some trainings that we do on diversity, equity, and inclusion, virtual think tanks, a fiscal pass-through service, leadership support, and training, and soon we'll even have a jobs bank. We don't have that yet. That's a little bit in the future, but it's coming. So as members of this co-op, then you'll be able to share what you're doing, and you'll be able to hear what others across the United States are doing. But the key, I really believe, Bill, you're onto something, to have these public health departments or the early childhood education groups as the backbones of these PACES Connection communities. To help us build and strengthen these relationships, and use PACES Connection and the model that we have, and the tools, the trainings, the PowerPoints, the videos, the blog posts, the handouts that you can put your own logo onto on parenting and what PACES means and wellness strategies. And what we're going to do when we do that, we're going to help you accelerate what you're doing. We're going to help you start what you're doing in the fast lane. So you can start out so far ahead of communities that are not aggregating these funds and leveraging these tools and taking advantage of the 10 years experience in working with communities that we have at PACES Connection. So we can help you start out and stay in the fast lane to accelerate the prevention of childhood trauma, to accelerate the healing of childhood trauma, and to accelerate in children and families and in your community the resilience that you need to help support people and get the growth and get the compassionate, healthy community.
All right, so that's, I think you can see that if you're a health department that's striving to show partnership, this is going to help you have a lot more progress and a lot more impact. But we combine the PACES connection and their programs with the ACEs and Resilience Resource Commons for communities. And each of these have abundant, freely shared resources. And while they both have an abundance of free, very good quality materials, they also have more programs that can be added on top of that. And so this can allow the public health departments engaging in these programs with their local coalitions can really build on the work of many others. So I want to just give you a quick tour. This is in the ARC Wiki, built on the same platform as Wikipedia. All these different strategies, from babies being born healthy and nurturing homes, to minimizing exposure to trauma, to expanding trauma-informed practices, and many other things. So minimizing exposure to ACEs and trauma would include all of these things. We'll look just quickly at minimizing bullying, one of the many forms of trauma. And here we have a concise information from very credible sources with research and statistics, and then being able to show some of the tools and resources. So here's an example from another topic, but it's looking at measures, descriptions, calculations, data sources. Here's the spreadsheet you can copy. Here's the survey you can use. So everyone doesn't have to reinvent the wheel when they're trying to tackle these issues. So this can allow local health departments to provide amazing system leadership as they build on work of peers from across the country. So the recommendation here to really accelerate your community collaboration and community teamwork and coalition work is to budget for 4 years of participation in the ARC Action Network and the PACES Connection Cooperative of Communities. And if you did this for 10 local health departments, many of those could serve a cluster of counties around them with one staff person, but participating in these programs, they're each about $5,000 a year, so that's $40,000 over the course of 4 years for both programs, but really providing this rich support, not just kind of a website, but the monthly, many sessions, coaching to really strengthen these. And this is helping you develop collective impact and system leadership skills that you can use on many other topics, opioids, chronic disease, and such. And it's going to build the community's capacity for addressing complex issues, including housing, aging population, and other things you'll need to deal with. So health departments can show they are knocking it out of the park with elevating their community partnership, which is a key priority.